In the competitive field of healthcare, job interviews can be daunting. To help candidates prepare, this video compiles the top 25 hospital job interview questions and answers, providing insights into what hiring managers typically look for. 1. Tell me about your background and experience in healthcare. I have spent over 5 years in the healthcare sector, initially working as a nursing assistant before advancing to a registered nurse. My experience spans various settings, including acute care and outpatient clinics. I've developed strong clinical skills and enhanced my ability to communicate effectively with patients and families. My passion for healthcare drives me to advocate for patients' needs while ensuring they receive the highest quality care possible. Additionally, I have participated in several continuing education courses to stay current with best practices and emerging healthcare trends. 2. Why are you interested in working at this particular hospital? I am drawn to this hospital because of its commitment to community health and its innovative approach to patient care. The hospital's reputation for excellence and dedication to providing comprehensive services aligns with my values as a healthcare professional. I appreciate the emphasis on teamwork and collaboration among staff, which fosters a supportive environment for both employees and patients. Additionally, the opportunity to work with diverse populations and contribute to improving health outcomes is particularly appealing to me. I believe my skills can help enhance the hospital's mission. 3. What do you know about our hospital's mission and values? This hospital's mission focuses on delivering compassionate, high-quality care to diverse community while promoting health equity and improving health outcomes. I admire your commitment to patient-centered care, emphasizing respect, dignity, and collaboration. The values of integrity and excellence resonate with me, as they guide not only clinical practices but also foster a supportive environment for both patients and staff. I appreciate your initiatives aimed at community outreach and education, aiming to empower individuals in managing their health effectively. This dedication aligns perfectly with my professional ethos. 4. Describe a time when you provided excellent patient care. During my time at the hospital, I encountered a patient who was anxious about undergoing a critical procedure. I took the initiative to spend extra time with them, explaining the process and answering all their questions. I also coordinated with the medical team to ensure they felt supported and informed. After the procedure, I followed up on their recovery, providing reassurance and additional information to ease their concerns. This approach not only alleviated the patient's anxiety but also fostered trust, ensuring they felt cared for throughout their experience. 5. How do you handle stressful situations in a hospital environment? In a hospital environment, handling stressful situations requires a combination of composure and effective strategies. First, I focus on staying calm and assessing the situation critically. Prioritizing tasks helps me manage my workload efficiently. I utilize deep breathing techniques to maintain focus and clarity. Effective communication with colleagues is essential, as teamwork can alleviate pressure. Additionally, I take short breaks when possible to recharge. Reflecting on past experiences allows me to identify patterns and improve my response to similar challenges in the future. 6. What steps do you take to ensure patient safety and prevent medical errors? Ensuring patient safety and preventing medical errors is paramount. I start by following the protocols for medication administration, double-checking dosages and patient identities. I maintain clear communication with my team to ensure everyone is aware of care plans and any changes. Regularly participating in training sessions helps keep my knowledge current on best practices. Additionally, I encourage a culture of reporting near misses without fear of retribution, as this fosters an environment where everyone learns from mistakes and continuously improves patient care processes. 7. How would you handle a difficult or angry patient? Handling a difficult or angry patient requires empathy and strong communication skills. First, I would remain calm and attentive, allowing the patient to express their concerns without interruption. Acknowledging their feelings is crucial, as it helps build rapport. I would then ask open-ended questions to clarify the issue and demonstrate my willingness to help. After understanding their perspective, I would provide clear information about possible solutions or next steps. If necessary, I would involve a supervisor or another team member to ensure the patient feels supported and heard, ultimately aiming to resolve the situation positively. 8. Describe your experience working as part of a multidisciplinary healthcare team. Working as part of a multidisciplinary healthcare team has been a rewarding experience that has enhanced my collaborative skills. In my previous role, I worked closely with doctors, nurses, pharmacists, and social workers to develop comprehensive care plans for patients. Regular team meetings allowed us to share insights and address any challenges collectively. I value diverse perspectives, which often lead to innovative solutions for patient care. This experience has taught me the importance of communication and respect in achieving shared goals and improving patient outcomes. 9. What is your approach to maintaining patient confidentiality and privacy? Maintaining patient confidentiality and privacy is a fundamental aspect of healthcare. I adhere strictly to HIPAA regulations, ensuring that all patient information is kept secure and only accessible to authorized personnel. I prioritize clear communication about privacy practices with patients, making sure they understand their rights. Regular training on data protection and privacy policies is essential for me and my team. Additionally, I advocate for using secure methods for handling sensitive information, including encrypted communication and restricted access to medical records, fostering a culture of respect and trust. 10. How do you stay up to date with the latest developments in healthcare? Staying current in healthcare requires a proactive approach. I regularly attend professional conferences and workshops, which provide valuable insights into emerging trends and innovations. Subscribing to reputable medical journals and online platforms helps me access the latest research findings and evidence-based practices. Additionally, I participate in professional organizations and online forums where healthcare professionals share knowledge and experiences. Engaging in continuous education through webinars and courses also enhances my expertise, ensuring that I provide the best care possible for my patients. 11. Describe a time when you had to deal with a challenging coworker. How did you handle it? In a previous role, I encountered a coworker who often dismissed the contributions of others during team meetings. This behavior created tension within the team. I decided to address the issue by scheduling a one-on-one conversation with them. During our discussion, I expressed my observations and how their actions were affecting team morale. I encouraged them to share their perspective and actively listened. This open communication helped us find common ground, leading to improved collaboration and a more positive atmosphere for everyone involved. 12. What would you do if you witnessed unethical behavior from a colleague? If I witnessed unethical behavior from a colleague, my first step would be to assess the situation carefully to ensure I fully understand what occurred. I would document the incident accurately, noting the specifics of the behavior and any relevant context. Then, I would approach the colleague, if appropriate, to discuss my concerns directly and encourage them to reflect on their actions. If the behavior continued or posed a risk to patient safety, I would escalate the matter to a supervisor or the appropriate authority. Protecting patient welfare and maintaining ethical standards is paramount. 13. How do you prioritize tasks when dealing with multiple patients? When managing multiple patients, I first assess the urgency of each situation by evaluating vital signs, patient complaints, and any immediate needs. I utilize a triage system to categorize tasks based on severity and time sensitivity. Communication with team members is essential, ensuring we are aligned on priorities. I create a checklist to track tasks, allowing me to stay organized and focused. Regularly reassessing the situation ensures that I can adapt to any changes in patient conditions, allowing me to provide timely and effective care while maintaining a high standard of patient safety. 14. What is your experience with electronic health record systems? I have extensive experience with electronic health records, EHR, systems, having used them in various healthcare settings. I am proficient in navigating EHR software for patient documentation, medication management, and scheduling. My experience includes training new staff on effective EHR use, ensuring accurate data entry, and maintaining patient confidentiality. I understand the importance of EHRs in streamlining workflows and improving patient care. Additionally, I have collaborated with IT teams to address system issues, enhancing user experience and ensuring compliance with healthcare regulations. 15. How would you handle a situation where a patient refuses treatment? In cases where a patient refuses treatment, I would first ensure that I fully understand their concerns. Open communication is key. I would listen actively to their reasons for refusal and provide them with clear, evidence-based information about the benefits and potential risks associated with the treatment. I would respect their autonomy while also emphasizing the importance of the recommended care. If the patient still chooses to refuse, I would document their decision and provide them with resources for further consideration. Continuous support and reassurance are vital in these situations. 16. Describe your approach to educating patients and their families. My approach to educating patients and their families focuses on clear communication and understanding their unique needs. I begin by assessing their current knowledge and concerns, ensuring I tailor my explanations accordingly. I use simple language and visual aids to enhance comprehension, making complex medical information more accessible. Encouraging questions creates an open dialogue, fostering trust. Additionally, I provide written materials for them to refer back to, reinforcing learning. Following up with patients ensures they feel supported and confident in managing their health. 17. How do you maintain a positive attitude during long or difficult shifts? Maintaining a positive attitude during long or challenging shifts involves several strategies. I focus on self-care by taking short breaks to recharge, even if just for a few minutes. Connecting with colleagues helps create a supportive environment where we can share experiences and encouragement. Setting small, achievable goals throughout the shift provides a sense of accomplishment. Additionally, I remind myself of the impact I have on patients' lives, which reinforces my passion for healthcare. Keeping a sense of humor also lightens the atmosphere, making tough situations more manageable. 18. What steps do you take to prevent burnout in this demanding field? Preventing burnout requires a multifaceted approach. I prioritize self-care by maintaining a healthy work-life balance, ensuring I take regular breaks and utilize my time off effectively. Engaging in mindfulness practices such as meditation helps me manage stress levels. I also seek out peer support and maintain open communication with colleagues about challenges we face. Setting realistic goals and expectations for myself keeps me motivated without becoming overwhelmed. Additionally, continuous professional development keeps me engaged and passionate about my work, helping to sustain my energy and focus in the healthcare environment. 19. How do you handle constructive criticism and feedback on your work? Receiving constructive criticism is an opportunity for growth. I approach feedback with an open mind, recognizing its value in enhancing my skills and performance. Initially, I listen attentively, ensuring I fully understand the points being made. I then reflect on the feedback, assessing how it applies to my practice. Implementing changes based on feedback is essential, and I seek clarification if needed. I also appreciate follow-up discussions to gauge progress. This proactive approach helps me continuously improve while fostering a collaborative work environment. 20. Describe a time when you had to think quickly and make a difficult decision. In my previous role, I encountered a situation where a patient suddenly experienced respiratory distress. The medical team was occupied with other critical cases, and I had to act swiftly. I assessed the patient's condition and recognized the need for immediate intervention. I quickly called for emergency support while initiating oxygen therapy and positioning the patient to ease their breathing. My prompt decision-making and quick actions stabilized the patient until the team arrived. This experience reinforced the importance of remaining calm under pressure and trusting my training in emergency scenarios. 21. How do you ensure clear communication during shift changes? To ensure clear communication during shift changes, I utilize a standardized handoff protocol that includes verbal and written reports. I focus on key patient information such as current conditions, medications, and any ongoing concerns. I encourage questions to clarify any uncertainties. Additionally, I make use of bedside handovers whenever possible, allowing incoming staff to interact directly with patients. This practice fosters a collaborative environment and ensures continuity of care. Regularly scheduled team meetings also help reinforce communication strategies and address any emerging issues. 22. What is your experience with hospital policies and regulatory compliance? In my previous roles, I have extensively worked with hospital policies and regulatory compliance, ensuring that all practices align with local and national standards. I have participated in training sessions on HIPAA regulations, infection control guidelines, and patient safety protocols. Regular audits and compliance checks were part of my routine, helping to identify areas for improvement. I also collaborated with management to ensure that staff were informed about policy changes and best practices, contributing to a culture of safety and compliance within the healthcare setting. 23. How would you contribute to improving patient satisfaction scores? To improve patient satisfaction scores, I would focus on enhancing communication and building rapport with patients. Actively listening to their concerns and addressing their needs creates a positive environment. Implementing regular feedback mechanisms, such as surveys, can help identify areas for improvement. Additionally, collaborating with the healthcare team to streamline processes ensures that patients experience timely care. I would advocate for staff training on customer service skills, emphasizing empathy and compassion, which are essential for fostering a patient-centered approach in healthcare settings. 24. Describe your experience with infection control protocols. In my previous role as a nurse, I adhered strictly to infection control protocols to minimize the risk of healthcare-associated infections. This involved regular hand hygiene, proper use of personal protective equipment, and thorough cleaning of equipment and patient areas. I participated in training sessions to stay updated on best practices and conducted audits to ensure compliance within my team. Additionally, I educated patients and their families about infection prevention measures, such as proper hand-washing techniques and understanding the importance of vaccinations. This comprehensive approach significantly contributed to reducing infection rates on our unit. 25. What are your long-term career goals in healthcare? My long-term career goals in healthcare involve advancing my expertise in patient care and leadership. I aspire to specialize in a clinical area that aligns with my passion for improving patient outcomes. Additionally, I aim to take on more responsibilities, possibly transitioning into a management role where I can mentor new healthcare professionals. I believe in continuous learning and plan to pursue further education, such as a master's degree in healthcare administration, which will equip me to drive positive changes within the healthcare system. Ultimately, my goal is to contribute to innovative practices that enhance patient care and operational efficiency. Remember, showcasing your skills and passion for patient care can set you apart from other candidates. If you found this content helpful, please like the video and subscribe to our channel for more valuable insights and tips to advance your healthcare career. Thank you for watching.